This video is brought to you by Collective One Benefits. If you find this video helpful, please click that like button, comment, and subscribe. Medicare. It's a word often heard as we age, signifying a new chapter in our healthcare journey. But what exactly is it? In essence, Medicare is a federal health insurance program primarily designed for individuals age 65 and older. It also extends its coverage to certain younger individuals with disabilities. Original Medicare, the bedrock of this program, comprises two key parts, Part A and Part B. Part A acts as your hospital insurance, offering coverage for inpatient hospital stays, skilled nursing facility care, and certain home health services. Part B, on the other hand, focuses on medical insurance. It covers a broad spectrum of medical services, including doctor's visits, outpatient care, preventive services, and durable medical equipment. Think of Part B as your safety net for routine checkups, managing chronic conditions, and addressing unexpected health issues. Together, Part A and Part B form the foundation of Original Medicare, ensuring access to essential healthcare services when you need them most. This two-part system provides a safety net, offering peace of mind as you navigate the complexities of healthcare in your later years. While Original Medicare lays the groundwork for your healthcare coverage, Medicare Advantage, also known as Part C, presents an alternative route. Unlike the traditional two-part system, Medicare Advantage bundles your Part A and Part B benefits into a single, convenient plan. These plans are offered by private insurance companies approved by Medicare. Instead of interacting directly with Medicare, you'll engage with your chosen Medicare Advantage plan for your healthcare needs. One of the key distinctions of Medicare Advantage lies in its structure and delivery of care. Most Medicare Advantage plans operate as health maintenance organizations, or HMOs, or preferred provider organizations, or PPOs. These plans often incorporate a network of healthcare providers, encouraging you to seek care within that network. By choosing Medicare Advantage, you're essentially opting for an all-in-one approach to your Medicare benefits, simplifying the management of your healthcare coverage. When choosing between Original Medicare and Medicare Advantage, understanding the nuances of their coverage becomes paramount. Original Medicare, with its Parts A and B, provides a solid baseline of coverage, ensuring access to a broad network of healthcare providers across the nation. However, it's essential to note that Original Medicare doesn't cover everything. It doesn't include prescription drug coverage, and there might be out-of-pocket costs like deductibles, co-payments, and co-insurance. Medicare Advantage plans, on the other hand, are required to offer coverage that's at least as comprehensive as Original Medicare. This means they cover all the services that Part A and Part B cover. What's more, many Medicare Advantage plans go the extra mile by including prescription drug coverage, also known as Part D, and offering additional benefits not covered by Original Medicare, such as dental, vision, and hearing care. However, this added convenience often comes with a trade-off network limitations. Medicare Advantage plans usually require you to use doctors and hospitals within their network. Understanding the financial aspects of your Medicare coverage is crucial for making informed decisions about your health care. Both Original Medicare and Medicare Advantage come with their own set of costs, including premiums, deductibles, and out-of-pocket expenses. Original Medicare typically involves a monthly premium for Part B, while Part A is often premium-free for those who qualify based on their work history. However, there are deductibles for both Part A and Part B, which are the amounts you pay before Medicare starts covering your healthcare costs. Medicare Advantage plans, on the other hand, may have lower or even no monthly premiums depending on the plan and where you live. However, they often come with deductibles for services like hospital stays and may have co-payments for doctor's visits and prescription drugs. Additionally, it's essential to consider the out-of-pocket maximums for both options. This limit caps the amount of money you'll spend on healthcare in a given year. While Original Medicare provides a solid foundation for your healthcare coverage, it doesn't cover all your medical expenses. That's where Medicare Supplements, also known as Medigap, step in to fill the gaps. Medigap policies are supplemental insurance plans offered by private insurance companies. They're designed to work in tandem with Original Medicare, helping to cover some of the costs that Original Medicare doesn't, such as co-payments, co-insurance, and deductibles. These plans can provide peace of mind, knowing that you have an extra layer of financial protection in case of unexpected medical expenses. However, it's important to note that Medigap plans are only available if you have Original Medicare. They cannot be used with Medicare Advantage plans. Section 6. Making the choice. Which option aligns with your needs? So, as you approach the age of Medicare eligibility, or maybe you're just contemplating your healthcare options, you might find yourself at a bit of a crossroads. You could be wondering, does original Medicare or Medicare Advantage align better with my needs and preferences? Well, the decision is a personal one, often influenced by things like your health status, your budget, and of course how much flexibility you want when choosing healthcare providers. If you value freedom of choice and the ability to see any doctor or specialist who accepts Medicare, then original Medicare might just be the right choice for you. This option gives you the flexibility to receive care across the country without being tied to network restrictions. On the flip side, if you're someone who prefers predictable costs, comprehensive coverage that often includes prescription drugs and maybe even some extra benefits like dental or vision care, then Medicare Advantage could be worth considering. It really comes down to what works best for you. Section 7. Exploring additional resources. Finding the right fit for you. You know, navigating the world of Medicare can sometimes feel like learning a whole new language, with all its acronyms, plan options, and coverage details. But, hey, you don't have to do this alone. There are plenty of resources out there to guide you, offering the information and support you need to make informed decisions about your healthcare. For starters, the official Medicare website, Medicare.gov, is a fantastic hub. It's packed with comprehensive information about Medicare, its different parts, and your eligibility. And let's not forget about state health insurance assistance programs, or SHIPs for short. These programs provide free, personalized counseling to help you better understand your Medicare options, compare plans, and address any questions or concerns you might have. So you've got support every step of the way. Section 8. Open enrollment. Your chance to review and adjust. You see, Medicare understands that life is always changing, and your healthcare needs might evolve over time. That's exactly why there's an annual open enrollment period. It's your opportunity to review your current Medicare coverage and make changes if you need to. This period typically runs from October 15th to December 7th each year. During this time, you can switch from original Medicare to Medicare Advantage, or even switch back if that's what you need. You can also change your Medicare Advantage plan or enroll in a Part D prescription drug plan if you don't already have one. Open enrollment really empowers you to take an active role in your healthcare, making sure your coverage stays aligned with your changing needs and circumstances. It's all about keeping things flexible for you. Section 9. Medicare's future. Adapting to evolving healthcare needs. You know, as healthcare continues to evolve, Medicare is evolving right along with it. The program is constantly adapting to meet the changing needs of its beneficiaries, address emerging healthcare trends, and ensure its long-term sustainability. One of the big areas of focus is improving access to affordable prescription drugs, which, let's face it, is a major concern for so many Medicare beneficiaries. Medicare is also exploring innovative ways to enhance care coordination, especially for individuals dealing with chronic conditions. By encouraging a more integrated approach to healthcare, Medicare aims to improve health outcomes and reduce unnecessary hospitalizations. As we look to the future, one thing is clear. Medicare's commitment to providing accessible, high-quality healthcare remains as strong as ever. And that's something we can all count on.